For more on all of this, we're now joined by Dr. Jennifer Prohaska, clinical psychologist and founder of Tactical Longevity. She's speaking from Overland Park, Kansas. I want to start with those comments you just heard us play there. President Trump saying it's not long enough. How does that impact mental health aboard a ship for U.S. sailors when you're hearing from the commander-in-chief concerns about mental health and psychological strain just waved away?
Right. So humans have three basic psychological needs: the need for control, the need to be heard, validated, or seen, and then the avoidance of pain or the option to avoid pain or suffering. And I think when someone says something like that, that's so invalidating about the experience. It just really doesn't click with, I think, people on the ships that are experiencing that. It's long enough for them, for sure. It's very invalidating.
And during these more than 250 consecutive days at sea, these sailors have carried out combat operations with uncertainty over when they're going to come home. They've had very little rest, a shortage of basic supplies. What does this combined prolonged stress and extreme environment do to one's mind? Give me a sense of what it's like to be one of those sailors.
Well, I think it's fair to say that most people can do very hard things. We are actually less good at doing uncertainty. So we can do hard things, but uncertain is really a struggle here. And so when those sailors are out there experiencing not only difficulty and the potential for exposure to danger, and then also uncertainty, it's overloading their system entirely. So the psychological pressure and the demands on them are huge. And the fact that there's no end in sight is very difficult. You have to realize that, again, we can do hard things if we know the end. We also can do very hard, difficult things if we have a purpose or a why behind them. And I think right now, a lot of people, including those people on the ship, are struggling with that.
I love that you named two very specific issues there. First of all, the certainty, and second of all, the reason, the why. And we're seeing the U.S. Navy increasingly asking its aircraft carrier groups to exceed the service's recommended deployment, which is a duration of 7 months. That's about 213 days. Should the expectations that these sailors are set up with before they go on their missions, should they change? And when you say give the why, what does that why look like for those sailors on board when it comes to their mission?
So I think the why is different for everyone. You have to kind of find your own why in those moments. Sometimes it's finding purpose and meaning by collaborating with your brothers and sisters on the ship. It depends on the person. Sometimes getting through hard things also requires having faith that you can make meaning in the situation later. And so we have to give some credit to the fact that they're going to have to be able to find that. We call that post-traumatic growth, the ability to look at a situation and say, I know I'm going to be able to take something from this eventually. I might not know what it is right this moment, but I will eventually know what that is.
And I want to break down very specifically these reports that we have of sailors going overboard or attempting to. Now, the Navy says that it has not seen an increase in suicidal ideation, but I imagine, of course, there are warning signs. What are those warning signs? Is it difficult in an environment like this to see those warning signs and identify them before reaching breaking point?
So my rule of thumb on that question is, with regards to suicide and suicide risk, the best indicator is knowing someone's baseline and then seeing a change from their baseline. Say they were normally happy, jovial, engaged, always meeting you at the chow hall, and now all of a sudden they're reclusive and withdrawn. That change from baseline is huge. Maybe they're a really more stern, serious person. All of a sudden they're kind of inappropriately funny. That change from baseline is your indicator that we're at high risk.
And you're talking about that change in baseline, but so much of military culture is built around resilience, endurance, following orders. Does that culture make it harder for some to admit that they're struggling or seeking that help that they need?
It absolutely makes it harder. We know that there's still a stigma around presenting with, hey, I've got a mental health issue I want to address. I do think that there's been many, many efforts made, and we're making huge strides in the area with regards to that stigma in the military and otherwise, but it's always going to be an issue that makes it hard to identify. Absolutely. The military has put in a lot of resources, especially in the last, I'd say, decade, to help address those things. Could there always be more? Yes. I also think it's very important to start pre-incident and think about, hey, if we're going to war, if we're going to high stress combat situations, how do we prepare people mentally ahead of time to be ready for those high stress experiences, no matter what that stress is?
Dr. Jennifer Prohaska, thank you so much for coming to us in the middle of your night to discuss those very difficult and challenging conditions that sailors are experiencing. Thank you so much.